that point, if I can come to you, Dr. Rajeev Jayadevan, while we've noticed that hospitalizations are increasing marginally, now we've seen an increase in deaths as well. 14 new deaths have been reported today, while for the last few days we were seeing that just 2 to 4 deaths were being reported. So while that is a slight uptick, do you think it's a situation to be alarmed about just yet?
I would not be alarmed. In fact, I would agree with Dr. Laria about where things are at this point. There is no doubt that there's an increase in number of cases, and that includes my own colleagues who have called in sick with COVID positive over the last several days. So there is clearly a spike in the number of cases. But most of these patients are being able to manage at home with home isolation, with a lot of fluids and paracetamol for fever and so on. Very few of the newly diagnosed patients are actually being hospitalized. But we know that a large denominator also can increase your numerator. In other words, with a large number of people testing positive, yes, some of them, especially those who are older or who have significant accompanying disease conditions, yes, they can potentially destabilize and be in the hospital. And from that standpoint, yes, we must also understand that as there is a birth rate for every country and every state and every city, there is also a baseline death rate, both of which are roughly the same. So if you look at the baseline death rate for the state of Kerala, for example, you can calculate it down to 680 per day. That is the number of people. That's a pre-pandemic mortality rate. That is just what is expected of the region. Now, among these people, clearly there will be some people who die at home. There will be some people who die in the hospital. Some people die of pneumonia, others of cancer, of stroke. And death is tragic. But now COVID also has been a player in that. Sometimes it may be a COVID positive status in a person who's already in a very bad shape, very sick condition. So when you hear the word 20 deaths occurred, it doesn't necessarily imply the same as though 20 people tested positive for COVID and died. That doesn't mean like that. Most of the people in the ICUs are people who are otherwise very ill from their own health conditions. And COVID also tends to aggravate their conditions. So I wouldn't want people to panic saying there are suddenly 20 deaths reported. It doesn't work like that. Now with increased testing, yes, we are aware, doctors are aware that many of these patients who are destabilizing could also have a COVID component to that. So that is also, I'm trying to put things in perspective here. I'm sure Dr. Ere will agree with that. So it is not exactly that these deaths are directly due to COVID, but I also have information that the majority of these deaths that have been attributed to COVID are also occurring in older individuals. So we saw how when Delta started, very, very young, say 20, 25-year-old people came, collapsed and died in casualty. So we are not seeing that kind of a carnage right now with this Omicron sublineage. I would not take it too lightly either, because we wouldn't want the hospital systems to be overburdened, because we don't have a lot of beds. In fact, no country has a lot of beds in, to treat a large number of people who might arrive suddenly. So it's important to have some baseline precautionary measures.
So I think the message is that there's nothing to be to panic about, but of course we have to remain cautious so that we don't see another wave after those lessons of the 3 previous waves, of course. And while we talk about the cycle of the coronavirus, Dr. Chandrakant Laharia, as you said, that this is something that we'll keep on seeing. This is how the virus is also, of course, evolving.